Good morning, everybody. This is Alaa Alrazaq. I am an assistant professor at Weill Cornell Medicine, Qatar. First of all, I would like to thank the committee of the Third Global Summit on Artificial Intelligence for this invitation. It is my pleasure to be with you guys. So, in this session, I will talk about the wearable AI for mental disorders. So I will share my presentations. So the outline of this presentation will be as follows. So I will give some background about this topic. Then I will move to the methods that were used to conduct two systematic reviews. After that, I will discuss the main results came from these two reviews. Lastly, I will show the main implications, the practical and research implications for from these results. So, as you know, mental disorders is like a very common issues worldwide. In 2019, a study showed there is 1 in every 8 people in the world affected by mental disorders. And these mental disorders account for about 7% of all total disability adjusted life years. And the most common mental disorders are the anxiety and depression, that are affecting around 301 million and 280 millions respectively. As you know, the mental screening the mental disorders is not an easy task. The patient has to visit a consultant or mental health professionals, and they have to spend some time with them, filling some questionnaires, having some interviews to being diagnosed or to identify whether he has a depression or anxiety. However, this approach has several limitations. The first one, they are subjective approaches. What I mean by this, they are relying on self-reporting symptoms that can be inaccurate or incomplete. For example, to diagnose anxiety and depression, patients, they have to fill in questionnaires or have an interview with the mental health professionals. During that procedure, they have to remember and recall some events in the past, like 2 weeks at least. So, and here maybe a recall bias will come to this answer, to their answers. So yes, this is one of the main issues, the subjective reporting, and at the end, these subjective and biases may affect the decisions of the mental health professionals. So the second limitation is the limited accessibility of the mental health professionals. In some, according to a study, there is only 9 healthcare professionals per 100,000 people in developed countries, and this issue is more serious in developing countries, where there is only 1 psychiatrist for 10 million people. Just imagine how healthcare psychiatrists or healthcare mental health professionals are scarce. So the third limitation is the stigma. Like, a lot of people, they are fear of stigma of being labeled as individuals with mental disorders or mental illnesses. So this is maybe prevent them to go to healthcare providers. And lastly, the financial constraints. Even if there are some healthcare providers or healthcare professionals, and they can access them. However, the consultation fees usually is very expensive, and also after the consultation fees, the medications or the treatment or the therapy needed maybe cost more. So all of these limitations affect patients to having a good access to mental health professionals and being diagnosed on time. And this is why we have a lot of underdiagnosed patients, and then we have a lot of untreated patients. So all of these issues may lead to a very like critical consequences, and maybe this is gonna delay the treatments for those patients, and these diseases could like develop more to be affecting the like physiological aspect of the patients. So there is a critical need for the approach could help in detecting and predicting mental disorders such as depression and anxiety. So with the advancement of technology and digital health, we have wearable devices that could help in predicting and detecting mental disorders such as depression and anxiety. The wearable devices usually have 4 characteristics or 4 advantages that make them suitable for such kind of tasks. So first of all, they are able to continuously monitor physiological and behavioral data from the patients, and which is a unique characteristic. So there is like, and as I said before, the previous method where only maybe you have to collect like cross-sectional data. However, here we are like progressively on continuously collecting the data, which is a very essential for predicting and detecting mental disorder. The second advantage, they are non-invasive. So the patient, they can wear these devices without any invasive procedures. So this is could like they will use it like anytime. Maybe they can wear it almost all the day, unless there is a very crucial need. There is a critical cases, like for example during the shower or sometime to charge the wearable device. So it is kind of non-invasive approach that is suitable for the patient. Thirdly, these wearables could collect multiple physiological and behavioral data, such as heart rate, respiratory rate, the sleep patterns and the quality, the stress. They can collect the SpO2, the oxygen saturation in the blood, the physical activity. All of these informations are very crucial for detecting and predicting mental disorders. Fourthly, these method or the collected data are collected objectively. So there is not subjective things that the patient has to remember and recall during the last 2 weeks. And this is by itself, it's amazing tools that maybe help in accurately detect or predict mental disorders. Just imagine adding to these wearable devices an AI component, make them even more better, like here where we coined the terms wearable AI, which refer to AI models that use a large amount of wearable data to provide a personalized feedback and detections. So yeah, so wearable AI is going to be a very suitable tool to early detect and predict mental disorders. There are many studies have been conducted in the past that showed various results. Some of them they showed like optimal performance of these wearable AI in predicting different mental disorders, specifically anxiety and depressions. On the other hand, there is some studies that showed harmful results of the performance of these wearable devices. And and there are several reviews that try to summarize the evidence from these previous experiments. However, these reviews had several limitations. For example, they didn't search some databases that are crucial in this field. Some of them, they focus on certain type of data, like neuroimaging data or EEG data, or heart rate data. Some of them, they just focused some of them they didn't synthesize the results statistically using meta-analysis, for example. Some of them focus on wearable devices without AI components. So all of these limitations lead us to think about conducting systematic reviews that are aiming to assess the performance of wearable AI in detecting and predicting anxiety and depression. So for this reason, we conducted 2 systematic reviews and meta-analysis. One for assessing the performance of wearable AI in detecting and predicting anxiety, and the other one was for detecting and predicting depression. So let me now move to the method section. In the method section, actually, we conducted both reviews and reported them based on the PRISMA guidelines. And the protocol of these 2 reviews are already registered at Prospero. So regarding the search strategy that we use here, we searched 8 key databases such as Midline, Embase, PsycInfo, SANAL, IEEE, ACM Digital Library, Scopus, and Google Scholar. We also performed what we call it the references checking, the backward references checking and forward references checking, which is checking the studies that cited the included studies, and this we also checked the references of the included studies. For searching the database, we used combinations of 3 groups of terms. One group related to the AI, the second group of terms related to wearable devices, the last group of terms were related to anxiety in the first review and the depression in the second review. For selecting the paper, we have 2 stages. In the first stage, we screened the titles and abstract of the included of the retrieved studies, and then we checked the full text of the retrieved studies. This step, study selection, data extraction, and risk of bias assessment as well, were conducted by 2 reviewers independently. So for data extraction, we extracted the main features of the studies and the wearable devices and the AI algorithms used, and then we extracted the highest results for each algorithm reported by the studies. For a risk of bias assessment, we used an adapted version of QuadAS tool to assess the risk of bias in the included paper. For data synthesis, we conducted a traditional meta-analysis. We also conducted a multi-level meta-analysis. Here we use this approach when there are more than estimates came from one study, and we wanted them to be included in the meta-analysis. We also conducted subgroup meta-analysis to assess the moderation effect of some variables on the performance of wearable AI. All the analysis were conducted using R. So let me show the results of the first review, which is the anxiety review. So here in this review, we identified 900. Let me has the pointer here. So here we have, by searching all these databases, we identify 918 studies. After screening titles and abstract and full text and removing duplicates, we ended up with 21 publications used in this review. So let me remove this one. So here as you can see from this figure, the countries in which most of the study were published were to 2020 and 2021, with 6 publication each. In terms of the placement of wearable devices, about 15 studies used wearable devices that are placed on wrist, and then we have 4 studies use wearable devices placed on head, 2 studies use wearable devices placed on chest, and 1 studies for eye, neck, arm, hand, and wrist. The most common algorithms used by the included paper were support vector machine SVM with 10 publications, followed by random forest. The aim of AI algorithm were for detecting anxiety in about 86% of the studies. And the remaining studies, which are 3 studies, use AI algorithm for predicting anxiety. The data input to AI algorithm were as follows, but the most common one were heart rate data, physical activity data, and EDA, which is electrodermal activity data. There are some other data, but actually there is no space to list all of these. So for the result, as you can see here, the accuracy were reported in 17 studies, and the number of estimates that came from these 17 studies are 40, and the total sample size used for data for meta-analysis were around 150,000, and the pooled mean accuracy were 82%. For the sensitivity, we have here like 2 studies assess the sensitivity from these studies we extracted 24 estimates which represent around 100,000 participants. So the pooled mean sensitivity was 79%. The specificity was reported in 10 studies, and from these 10 studies we extracted 24 estimates and representing around 46,000 participants. The pooled mean specificity was 92%. So in terms of the heterogeneity, as you can see from this results here, there is significant heterogeneity in these estimates, as you can see from these p-values. With regard to subgroup analysis, we conducted 6 subgroup analysis to assess whether the performance of wearable devices are different with different algorithms, different aim of AI, the status of wearable device used, whether it's commercial wearable device, non-commercial wearable device, whether the wearable device, the type of wearable device used, like whether it's Fitbit or like Empatica or anything else, data type used in the models, like whether it is the model are based only on wearable device-based data, or the models are based on wearable device data plus other data, like questionnaires or mobile applications or any other kind of data. The last subgroup analysis was like using the was about the validation approach, which is like whether the how the AI algorithm was validated. Like, for example, the data was split into two different data set using the approach k-fold cross validation, or Turing test split, or leave one out cross validation. So as we can see here from this p-value, all these subgroup analysis didn't show any statistically significant results. So that means the performance of wearable AI is not affected by these factors. However, we have to be cautious in interpreting these results, because the number of studies that were used in this subgroup analysis were very small in most of them, like less than 4 papers. So let us move to the second review, the results of the second review, which is the depression review. Here, by searching the 8 databases, we retrieved 1,314 paper. After moving duplicate, screen titles and abstract, and reading the full text, we got 54 publication used in this. The studies were published between 2015 and 2022, and the year in which the largest number of the studies were published was 2022. Most of the studies, almost all of the studies, use wearable devices that are placed on wrist. Only one studies used wearable devices that are placed on head, lower back, fingers, chest, wrist, thigh, and ankle. So regarding the algorithms, these are the most common algorithm used. However, the most common one in this review was random forest with about 33 publication use this algorithm, followed by logistic regression. The most common data used for developing the AI algorithm were these data. But the most common one was the physical activity, followed by sleep data. For the results of this review, accuracy was assessed in 35 publications, and from these studies we extracted 75 estimates of accuracy, and these estimates were from around 250 participants. The pool mean accuracy was 89%. The sensitivity was assessed in 29 studies, and we extracted 58 estimates from these 29 publications, and the total sample from this for this estimate were around 54,000, and the pooled mean sensitivity was 87%. The specificity was reported in 28 publications. We extracted 54 estimates from these 28. The total number of participants were around 158,000 participants, with the pooled mean specificity were 93%. As you can see here, the heterogeneity were statistically significant for all these meta-analyses. We performed 5 subgroup meta-analysis to assess whether the performance of wearable AI affected by the algorithm type, the aim of AI, the wearable device used, the type data, and the reference standard. So as we can see here, all subgroup analysis showed statistical significant difference, except for algorithm that showed that there is a statistically significant difference in the performance of wearable AI based on the algorithm. So according to these results, we can draw several practical and research implications. First, the wearable AI is not ready to be used in clinical practice as for several reasons. The first, like this review showed, its performance is not optimal, and there is a room for improvement. And the most studies use sample size less than 50. Moreover, like very few studies that were judged as a low risk of bias in all domains. So these make us to conclude that wearable AI shouldn't be used as a substitute of the current screening approach. However, it could be used in conjunction with the current approaches, such as the questionnaires and interviews. Another like implication that we can draw here, it is, we need more wearable AI for predicting anxiety and depression rather than detections, because predicting the anxiety and depression is important to provide an early interventions, and this is gonna hopefully prevent them happening before it's being complicated. So yes, we need more wearable AI for predictions rather than detections. The third implications that I really want to stress on, which is we need commercial wearable devices that has an AI embedded into them, because all the current wearable devices mentioned in these papers don't have the AI elements embedded in it. So all these studies use AI that's stored on computer or a cloud, and apply it to analyze the data collected by wearable devices. However, we are I hope the tech company try to develop wearable AI, wearable device that has an AI embedded into them, similar to these wearable devices that can check stress regularly. We have the Fitbit, we have Empatica, all of these wearable devices check the stress regularly in the wearable device. I know maybe this is going to be a bit complex, because adding or embedding AI to the wearable device may need like a computing power to that wearable device to be able to use AI in it. Yeah, so the fourth implications, which is also important. So I would like to encourage researchers to conduct more studies to assess the performance of wearable AI to differentiate between different types of mental disorders. Let me explain here more. All studies in both reviews use wearable AI to differentiate whether this patient has anxiety or not, or has depression or not. However, maybe we need to assess whether the wearable AI can differentiate between the patient with anxiety or depression or phobia, or maybe stress, or something else, some other forms of mental disorders, or illnesses. So this is going to make it more more useful for clinical practices, because in clinics we don't assess this patient has depression or not. We may be trying to identify whether the patient has this mental disorder or this or that, right? So this is what we future studies should focus on. Okay, so and also I would like to encourage future studies to improve the study design in terms of the sample size, the durations of the data collections, and using multimodal data. Let me explain here more, especially related to the multimodal data. Most of the studies included in this reviews were actually we're using one type of data, which is wearable device data. Some of them, they added like clinical data, such as the history or some medications, etc. However, if we add data from different aspects, like for example, from questionnaires, like to assess the anxiety, depression, mobile data, like maybe let us say like the calls or messages on their mobile, or GPS signals, or the environment, like the environment in that day, and also the could we have the like even images, like in neuro images, you know, a lot of studies showed that neuro images could be effective in identify the to detect or predict the anxiety and depression. So multimodal data will make it more comprehensive way to predict and detect depression and anxiety. Lastly, I would also recommend the researchers to compare the performance of different wearable devices. For example, they can compare the performance of Fitbit against Empatica, against Apple Watches, Galaxy smartwatches. All of these could be like could add value to check which one has the potential to improve to detect or predict anxiety and depression. So in conclusion, I would say that wearable AI has the great potential for detecting and predicting mental disorder, especially depression and anxiety. However, we still like in early stages. We need to improve these. We have to improve the performance of these technologies by collaborative efforts, by more research, and hopefully by near future we will witness like higher performance that reach around 98 or 99% accuracy, sensitivity, and specificity. That's all from my side. Thank you very much. I'm here to answer your questions. Thank you. And this is the QR code for my LinkedIn profile if you want to connect and have more discussion about this paper. And also I'm showing another QR code for anxiety paper and a depression paper. Thank you very much.